Hello, this is Robert DiDio. I'm going to be going through a teaching plan for the self-administration of an epinephrine auto-injector. This is going to be abbreviated for two reasons. One is to allow for uploading of the video, and the second is because of the COVID quarantine where I cannot do this in front of a live audience. So we have an audience of patients here who may need a epinephrine auto-injector, and I'll be going through the lesson plan. The first is to identify the potential causes of anaphylaxis. Anyone who has a history of allergies or is on allergy shots should have an epinephrine auto-injector prescribed. Some of the most common causes of anaphylaxis or shock would be peanuts, bee stings, shellfish, certain medications, dairy, latex, and many other things. So the first step is to identify when the auto-injector may be needed. The most common signs and symptoms of anaphylaxis would be trouble breathing, wheezing, change in the voice, hoarseness, hives, red raised areas all over the skin at any part of the body, severe itching, swelling, particularly of the lips and the face, fast heartbeat, weak pulse, feeling very anxious, a feeling of impending doom, confusion, stomach pain, loss of urine or bowel control, diarrhea, or stomach cramps. So anaphylaxis is serious, and it's important to have the auto-injector to use. So next we're going to go through the steps involved in administering the auto-injector. This is a training device here that we're going to practice with today, and it very closely resembles the actual auto-injector that you'll have. It's important, number one, to remove the blue cap from the auto-injector before you use it. So we've identified when we're going to need the auto-injector, and the first step is to prepare it. And all we have to do is remove the blue, and then it's ready for use. Now, to administer the epinephrine auto-injector, we're going to look for the lateral thigh. And all we do is we're going to take it in the right hand, and we're going to place it firmly in the lateral thigh and hold it for 10 seconds and count. This will allow for the administration of the medication. And then the needle will engage and administer the medication into the muscle in the lateral aspect, the side of the thigh. We're going to withdraw the auto-injector, and the needle is retracted. And then the next step, step 3, after we prepared it and administered it, is to call for help. It's very important not to assume that the patient or your friend or loved one will be better immediately after the injection, but at least you've administered something that's life-saving. So the next step is to call for help. And the fourth step later on is to dispose of the auto-injector properly. Take it to your doctor's office where they have a needle disposal kit. So those are the steps involved in administering the epinephrine auto-injector. Certainly, we can discuss some concerns that you may have. A lot of family members certainly may feel unsure of when to administer it. Certainly, if any of the signs that we mentioned, particularly if there are many of them, are involved, we would want to administer the injector. It's important to administer it rather than withhold it. Another concern may be, did I administer it properly? The nice thing about the injector is that there are training videos online that you should frequently assess as long as you have the auto-injector to make sure that you review the steps. The second is that the steps are printed directly on the auto-injector. And the third is that the auto-injector is mostly self-sufficient. If the blue cap is removed and is placed into the lateral thigh, it will deliver the medication quite easily. We can go over some further concerns that you have right now, and then if anyone would like to re-review the steps or practice with the auto-injector, we can do that. Thank you very much. I'm hopeful that you will not need to use it.